Okay, so my research study is looking at the neuroimaging effects of cognitive behavioral therapy on fibromyalgia, and this is being taken place at Brigham and Women's Pain Management Center in Chestnut Hill under the investigator of Rob Edwards. So just some background, fibromyalgia consists of fatigue, cognitive symptoms, and somatic symptoms, and affects 2 to 7% of people in nations across the world. So to the side, I just found a picture online that talks about the symptoms that fibromyalgia patients can present with, and muscle aches is listed, stiffness, a brain fog relating to cognitive symptoms, and stomach pain are seen in this picture. And catastrophizing are negative emotions and thoughts related to elevating levels of pain, feelings of helplessness when in pain, and increasing pessimism of pain. And catastrophizing is related to pain, just in a general sense, not even necessarily fibromyalgia, but overall in chronic pain. And Van Wilgen, Van Intersum, Kaptein, and Van Wee, they found that catastrophizing has a strong cognitive component affecting patients' pain, increasing distress levels, and relating it to poor outcomes for patients. So these patients are people who think, I am in so much pain, this is so bad, my back hurts so much, and these thoughts lead to treatments not working as well for these patients because their negative thoughts are taking over and taking control of their pain levels. And catastrophizing has a relationship to fibromyalgia pain. Campbell et al. Found that therapies that help with fibromyalgia pain decrease catastrophizing. So he saw that these patients, when their fibromyalgia pain was helped, so was their catastrophizing thoughts. So cognitive behavioral therapy has actually been used in children with fibromyalgia from Kashikar Zak, and he found that you can reduce catastrophizing thoughts and improve self-efficacy in these kids by teaching coping strategies and teaching them about cognitive behavioral therapy. So the way that you change your thinking will influence your behavior, and therefore your pain will get better with fibromyalgia. Baranuik, Whalen, Cunningham, and Claw found that differences in pain threshold for fibromyalgia patients related to differences in the patient's brains, and specifically the differences in the activation of the primary somatosensory cortex, the anterior cingulate cortex, and the prefrontal cortex, seen by using the fMRI scans. And Ange et al. Found that cognitive behavioral therapy increased the pain threshold of fibromyalgia patients by looking at fMRI scans while patients were given a painful stimulus. So over time, cognitive behavioral therapy helped these patients with pain, and they were able to increase the amount of pain that they could handle through given the coping strategies cognitive behavioral therapy has to offer. So in our lab, we're focusing on the same thing. We're looking at how fibromyalgia participants catastrophize more than healthy controls, and these will be looked at through the questionnaires that we will be giving them. And the cognitive behavioral therapy group of fibromyalgia participants will decrease in catastrophizing more than the education about pain group of fibromyalgia participants will, because CBT will offer them coping strategies and ways to handle their pain instead of just giving them education about pain. And the fibromyalgia participants will show a decrease in their catastrophizing after CBT or education therapy. So overall, we're expecting in this study, we want the participants to experience some level of relief from their pain from both treatment groups. So just an overview of the participants and the procedures that were being conducted. So the participants were recruited through flyers, phone calls, and being referred from other parts of Brigham and Women's. You can be referred from a doctor, and there's also a website dealing with the specific research at the Brigham being conducted, so they could be referred to from there. There were 300 women participants in the study. There were healthy controls, and there was 50 of them, and then fibromyalgia consisted of 250 participants. And those were then divided into the CBT group with 170 as an N size, and the education about pain group as 80 for the N size. And so the participants went to the Brigham for their first visit, and here they were given the signed informed consent form, and then they filled out questionnaires. And these questionnaires included basic demographic information and a medical history form, just a control for those variables, and the brief pain inventory, the PROMIS 29, and the pain catastrophizing scale were given to these, and this is going to act as the pre-treatment measure to measure how badly the pain is in these patients and how badly they are catastrophizing. So then the participants went for an fMRI scan at the Martino Center for their second visit. And at this fMRI scan, they were given a painful stimulus, and the fMRI scan picked up on the areas that were affected in the brain and what areas of the brain reacted. And this was used to see the differences between a healthy control group and the participants with fibromyalgia, to show that there are brain differences going on here. And then after this, the healthy controls were no longer needed for this study, so the rest of the study just focuses on the fibromyalgia patients. So then afterwards, the fibromyalgia participants were divided into the cognitive behavioral therapy group or the education about pain therapy group for 8 weeks, and there was an fMRI scan at week 4, again at week 8, and at a follow-up of 6 months. And the same thing happened here. They were given a painful stimulus, and the brain scan was measuring the differences that were being conducted between the CBT group and between the education therapy group to see if CBT is helping, and overall in general to see how the CBT group or the education therapy is helping these participants cope with pain and increase their pain threshold. And also at this 6-month follow-up, the participants were given the same questionnaires again, the brief inventory scale, the PROMIS 29, and the pain catastrophizing scale as a post-measures treatment. So just to explain the measures, the brief pain inventory is a scale to measure a participant's severity level of pain and how pain interferes with his or her daily life and functions. So it's a self-report on a scale of 0 to 10, 0 being not severe or not interfering, to 10, which is completely severe or not or completely interferes. So the picture on the left is talking about the interfering part of the questionnaire. So the participant would circle 0 to 10, and depending on the last 2 weeks, how their pain has interfered with their life. So example, for normal work, they would circle a 1, maybe if the pain is there, but they're functioning fine and it's not very interfering, or maybe they would circle a 9 if they haven't been able to go to work or to cook or clean around the house. And the PROMIS 29 scale, this is comprised of a generic profile of health-related quality of life measures which correspond to clinical findings on patient health and epidemiological evidence in the community setting. This is a 29-item questionnaire involving an 11-level pain intensity scale. The ratings vary depending upon what is being asked. So for example, when the scale has questions about physical function, the ratings go from without difficulty to much difficulty, and if the questions involve fatigue, the ratings are from not at all to very much. So for the example given, questions number 3 and 4, they're dealing with physical function. So the participants would then rate from not difficulty to much difficulty, and they would check the box which relates most to them. And then lastly, the pain catastrophizing scale. This is a scale developed to measure rumination, magnification, and helplessness as different levels of catastrophizing related to pain. So this is 13 statements comprised And participants have to relate them from 0 to 4 to express how relatable these statements are to their life within the last 2 weeks. And so 0 to 4 is a self-report scale referring to not at all to all the time. And so, for example, 1 and 2, I worry all the time about whether it will end. It is referring to pain, and someone who has high levels of catastrophizing would probably write a 4. So overall, this study is just going to be used to help people with fibromyalgia learn better coping strategies and hope to diminish these catastrophizing thoughts in relation to their pain getting better.